Hello and welcome to the Sisters for Fitness Wellness Show. I'm Stephanie Gaines-Bryant. Our guest today is Billie Hamilton Powell, and she's a certified nurse midwife. And we're talking about midwifery.
Correct, correct.
In other words, women giving birth, the whole OBGYN experience.
Absolutely.
Now, do you find nowadays that women are moving closer to natural birth than they used to be?
Absolutely, absolutely. More and more women now are wanting less interventions during their birth. And so that's what we're trying to provide for women these days.
And what does that include? A lot of times that means to women that you're not going to get an epidural, but it means much more.
Absolutely. They can decide that they don't want an epidural. They want different positions when they're delivering. They want to have their partners with them. They don't want as much monitoring, like the fetal monitor, on them. They want to use water therapy. And so we're giving them those alternatives for their birth.
And how do you do that? For example, if you say, well, I would like to give birth in water.
Mm-hmm.
How does that work?
Okay, so there are different ways in which we do that. We have to screen them to see if they're actually eligible to birth in the water. And if they do, then we can have them labor in the water. And we have jacuzzi tubs that are in our facility that they can actually just labor in there. So they submerge themselves in the water, and that helps them to relax. And they can labor in there for hours if they want to.
And we're not talking about giving birth at home. We're talking about giving birth in the hospital, but making it a home-like experience?
Yes, our facility has what we call a birthing center. So we have beds in there that are like home. We have a jacuzzi tub. We make it so pleasant for them to be in there so that they can have dim lights, they can have soothing music, they can have the water therapy, they can have their family surrounding them so that they can have just the experience like at home, but in the hospital itself.
How important is it? I know for my family, it was a very unique experience. It's a once in a lifetime experience for most women. And you want that experience to be positive, to be a pleasant experience. And it sounds like you all work toward giving women that. But as we know, babies are not always predictable.
Right.
So do you come up with some sort of birth plan for the mothers ahead of time?
Yeah, so during the prenatal visits, we talk about a birth plan, what we'd like to have happen during the birthing experience. So I can tell them what we can offer during the birth, and then they can say what they would like to have. And together we sort of plan this experience, knowing that depending on what's going on with mom and baby, we might have to change it depending on what's going on, okay? And so with that, we can say, hey, you know, we can provide this for you, because sometimes they don't know that they can have these options. You know, it's like, hey, did you know you could sit in the shower? You can use the birthing ball. You can be in a rocking chair.
Wait a minute, what is a birthing ball?
So a birthing ball is actually an exercise ball. It's an inflatable big ball that they can sit on, and we have them rock on that, because what that does is it relieves the pressure in the vaginal area, and it also helps open up the pelvis, so they can rock on that to help relieve some of the discomfort. So we give them all the options that they can have, and they may not even know about it, so that we can plan it together to make sure that they have the best birthing experience.
I had never heard in all.
Yes, there are birthing balls, there are peanuts, there's rocking chairs. We have
The rocking chair is the same theory?
Yes, there's a birthing stools. We have all kinds of things and options that we can use to better manipulate to help the birth progress better without using, say, medical manipulation. I call it our midwifery magic that we can use.
What is the optimal position for giving birth?
anything besides being on your back, okay? Because physiologically, if you lay on your back, it sort of presses down on the pelvis and doesn't allow it to open up appropriately. So when we want to birth a mom, it actually is better sometimes to stand or squat or be on all four because it opens up the pelvis more. So if we have a mom who is on her back, we might tell her to turn on her side or get on all four or stand up or squat, because that will relieve some of that pressure on her back so that they would open up the pelvis more and allow her to birth a little easier.
And that sounds right. But whenever you see these births on TV, whether it's a sitcom or a drama, it's everybody's on their back.
Exactly.
And that's not right.
No.
Gravity doesn't like that.
Exactly, exactly. So we incorporate squatting bars. We will have women standing up. We will have them squatting on the floor. We will have them on all four. We love changing positions in order to help facilitate birth in a different manner.
Do you find that women who have given birth before their second or third child are more open to midwifery than women who are having a child for the first time?
I think it's sort of open, just depending on how they've researched the birth. A lot of my new younger moms now are researching it more and saying, hey, you know, I want to be open to more options. And so they're looking at midwifery now and saying, I have the freedom of doing a little bit more. My older moms are looking at it and saying, hey, this is my first birth. I've researched it more. I want to have some more options. And so they're saying, hey, midwifery may be my choice instead of going into the traditional OBGYN office. So I think it's playing on both ends now for the choice.
If you're high risk, do you have as many options? Or should you even bother with that? You should still look into your options if you're considered high risk?
You do still have the option of doing midwifery care. You can work in collaboration with your OBGYN and a midwife. So with our practice, you still have to go through the physician, but during delivery, we can work with the physician to help facilitate with your delivery. So if there is a high-risk patient who comes in who says, I really like to have a midwifery delivery, we can work with the physician to help facilitate that if that's desired.
You were talking about a pre-plan, planning ahead.
Mm-hmm.
Do you get to do a dry run? I mean, do you get to see what the tubs look like, what the balls look like, what the room might look like?
You can actually go through it and have a tour if you want to. That is not a problem. And when you do prenatal classes, they'll talk about it and describe those things to you. So those are the ways in which you can sort of see some of those options out there. But a dry run, no, not really. But through prenatal classes, through tours, that's where you get some of that information about those options.
In preparing yourself to give birth, how important is breathing?
Oh, I think that is one of the biggest things that we tell people to do, because you have to learn how to relax during the birthing experience. Most people, when they come in, there is this time where you need to understand that there is a peak of pain, and in order to get through that time, you have to learn how to breathe through it. There is a contraction that lasts between 60 and 80 seconds, and it builds up. And so there is a breathing technique with that. And then there's a breathing technique with pushing. And then there's a breathing technique to get through some of the other parts of say, like, I am going to repair you. Those are the things that we say, that those relaxation techniques that we need to do. So yes, breathing methods, relaxation, imagery, those are all things that can help you along the way.
And who knew that something so simple is breathing can help you, because those pains are killer.
Yes, I
Can
mean,
help you through those pains.
right, because the whole body, the muscles within the pelvis have to relax. And so if you tighten up too much, it's not going to allow the baby to drop down into the pelvis. So by breathing, relaxing, it's going to help relax that whole pelvis, allow the baby to drop down and help facilitate that dilation and the baby to come out. And so by relaxation, by breathing, by that imagery of saying that I can do it, by positive reinforcement, that's going to all help with the birth of that baby. So we, as midwives, we help facilitate moms in that breathing and encouraging her and that positive reinforcement, because there's definitely stages in the labor process. And when we get into that final process of labor, it can be very, very intense. And that's where we say we need to make sure that we're giving that positive reinforcement, understanding, telling that mom to keep breathing, to keep relaxing, because it can be very intense for her. And so by being there to support her, having the labor support people, giving that relaxation techniques to her, giving that support to her, can help her, if she wants to do a natural birth, to keep her on target to make sure she gets to that final destination.
And if you don't do the proper breathing, if you're up here during the whole, it lengthens
Right.
the time that you're in labor.
Right.
So learning those techniques is just so important. How important is family involvement?
Oh, I think it is absolutely necessary, especially, like I said, in that last part of the labor process, because what it was called transition, you almost lose control. And most women, they say, I just can't do it anymore. And by having the loved ones around you and that support and encouragement, I have seen so many women, clinging on to their partners, and that love and support gives them that fortitude to say that I can make it through. It also, by having those people there, the integrity of their tissue in the vaginal area, they can just support it and breathe through and hold on to someone. They can be able to just make it through that last part. And knowing that someone is there for you is more encouraging to say, yes, I can do this. I can definitely do this.
Now, people talk about what happens before and during, but are you with the patients after? There's a whole process that takes place after as well.
Absolutely. So after the patient is delivered, there's that rounding on them afterwards and that teaching afterwards, because we are big advocates of breastfeeding. It is one of our #1 goals to understand what are the benefits of breastfeeding a baby. So afterwards, teaching a mom how to take care of herself.
What are the benefits of breastfeeding opposed to bottle feeding?
The benefits of breastfeeding are the bonding for the baby, to help with postpartum hemorrhaging and bleeding. The uterus shrinks down a lot faster. Moms have a decreased risk of postpartum bleeding because of that. The bonding with the baby that they have. Babies don't have as much allergies because they're never allergic to the breast milk with that. Benefits to the baby itself, that they have the nutritional value of that breast milk, the cost value for moms. Breast milk is absolutely free, okay, for that baby. Those are the things that we look at for that decrease in obesity of babies, for that decrease in allergies. We have so many babies now that are saying that they're having so many new allergies, but we can reduce a lot of that with breastfeeding.
How long should the mother breastfeed? Or are we talking about for a few weeks, a few months? What is the optimal amount of time for a mother to breastfeed?
We want a mom to breastfeed totally nothing but breast milk for the first 6 months. It doesn't need any water, it doesn't need any juice, it just needs total breast milk for the first 6 months. Okay, and so we encourage a mom to do that, and then breastfeed as long as she wants to, at least for a year.
How do you do that? Or it's very difficult. We've got a lot of moms out here who are working moms who have other children. How do you emphasize that maybe you have to make time for this?
Okay, so moms who are working, I say this: get up in the morning, breastfeed your baby. Then at work you can pump. It is by law that you're supposed to have a place to breastfeed, okay? And it's to pump. And it's supposed to be a place that is not a bathroom, okay? Yes, it is mandated by law. Also, insurances cover breast pumps. So if you need a breast pump, ask your provider to provide you with a prescription, and you can get a breast pump provided for you. So in the morning time, you feed your baby, pump your breast during the daytime at work, and then when you come home, you can breastfeed your baby. And then that breast milk that you had when you pumped during the work is what you give the babysitter during the daytime. And then you can continue to breastfeed your baby that way. But it is possible. And then there are lactation consultants out there that can also help you in understanding how to continue with that breastfeeding as a working mom.
Lactation consultants?
Yes, lactation consultants. We have lactation consultants in the hospital too. If you're having problems with establishing the breast milk, if you're having problems with the baby latching on, if you're feeling like you don't have enough supply for the baby, we have all those services there.
Because those are concerns as well. I know, do I have enough milk?
Exactly.
Is the baby getting enough?
Right.
Am I doing this right?
And the midwives talk about that in that postpartum period, like you said, that follow-up right afterwards. Most moms afterwards say, you know, I don't see enough milk coming out. I want my baby to have a bottle. And we're like, wait a minute, those breasts are providing enough milk. That baby's tummy is only a marble size. It's getting enough. You put that baby on that breast. That baby's gonna treat you like a pacifier in the first 48 hours, but that's okay. All right, we just want to see a couple of wet diapers. If that baby's producing a wet diaper, then you're doing just fine. Most moms are expecting this big flow of breast milk coming out of the breast, but that's not actually what it's supposed to be doing. We just see some drops coming out, and that's okay. All right, if you start giving the baby bottles in the first 48 hours, you're going to stop producing milk. So we try to encourage moms no bottles in the first 24 to 48 hours. We just want to give that baby that breast in the first 24 to 48 hours to establish that breast milk in the very beginning.
How can your partner help with this? Of course, your partner can't breastfeed, but how can your partner kind of be there to help assist with that during those early times? Because, you know, the partner wants to be part of this situation as well.
Absolutely. So the partner, when you're laying in the bed and the baby is crying, partner gets up, gets the baby, gets the diapers for you, you know. Those are the things that the partner can do.
Or if you've pumped, the partner can help with that too.
Absolutely. That's after you've established. The partner can use the bottles if you've done that, but we ask in the first couple of weeks that you just do the breast in the very beginning.
Okay.
But once the breast milk has been established, you can put it in the bottles, and then the partner definitely can use the bottles and use that.
Can breastfeeding prevent you from getting pregnant again?
It can if you're exclusively, but we say that there is a possibility that you can get pregnant while you're breastfeeding too. You can ovulate, so we do tell people to try to use a backup form of birth control.
We see on TV people who give birth and they seem like they go back to their regular size immediately. That's not reality.
No, it isn't. So, you know, what was it, Kate, the role?
Yes. Yes, you come out of the hospital and you're slim and trim and you can do commercials after that.
Right.
That's not reality.
No, it isn't.
How do you help the mother get back to her pre-pregnancy self?
So we tell them, you know, 6 weeks afterwards they can start exercising. Breastfeeding actually does help you lose weight. So that is one of the things that we encourage them to do. That helps them lose weight. Watching what they're eating. With breastfeeding, you do not have to, you know, say add extra calories like you need to, but daily exercising, watching the intake, those are the things that we want them to do. Keeping up with the prenatal vitamins, that can be definitely a thing that they can do. But they can definitely start the workout 6 weeks afterwards. We don't want to start them too early with the workouts because heavy duty exercising right after delivery can actually increase their bleeding. So we want to make sure that we're being very careful about that.
Should you watch what you eat when you're breastfeeding? Does what you eat affect the baby?
What I tell moms is that watch how the baby reacts to what you're eating, okay? If the baby is gassy after something that you've eaten, then I would avoid that. But there really isn't much, except for, you know, they say, yes, avoid alcohol. Those are definitely something that you want to avoid. But someone says, you know, can I eat broccoli? You know, well, if you ate broccoli and you felt like the baby was very gassy after that, well, maybe you might want to avoid
What
that.
about spicy foods?
Oh, you can have spicy foods if you want to. If you felt like the baby was okay with that, then that's fine.
With midwifery, you don't just deal with women in pregnancy. You deal with women's health in general.
Yes, a lot of people when you talk about midwifery, they think, oh, we just do pregnant women, but actually we do women through the lifespan. So might have a teenage patient here who says that I'm having irregular periods. I can take care of her. I can take care of a woman who comes in who says I just need a pap smear. I can take care of her. I might have a woman who's in her 60s who is now menopausal. She can be my patient as well. We take care of GYN patients as well as pregnant patients.
Because when I was talking about interviewing you and I was told about midwifery, I'm thinking the wild, wild west or the old South, and the midwife comes in, let's get boil the hot water.
Yes, yes.
I didn't think of you as just dealing with overall OBGYN health.
Right, right. And that is usually the misconception of midwives, home births only, you know, but we are full scope OB/GYN care providers. And there are some midwives too, because our scope also covers infants up to 6 weeks as well. Now, our practice does not do that, but in the training of midwifery, we are primary care, GYN, OB, and infants up to 6 weeks of care. So that's the scope of midwifery.
Why would you, can people ask for a midwife opposed to other options? And why would you ask for a midwife?
A lot of women ask for midwives, and the traditional definition of midwives is with women. And we do a lot of education for women, that personalized care, the teaching, the one who wants more of the personalized touch. And I think that's why a woman would come to us.
Now, it sounds like it's in your blood. You told me off air, I hope you don't mind my mentioning, that you come from a family of midwives.
Yes, I did.
Which is incredible.
Yes, my great-grandmother and my great-great-grandmother were what they call granny midwives, and I actually have a picture of her that I pay homage to in my office. Back in the day where they delivered at home. I love the story of them delivering at home, and one of my relatives told me how she made sure she had her $25 to make sure that she could pay my great-grandmother for her delivery at the time, and I keep her little log of her births in my drawer.
Wow.
Yes.
And just here we are many, many decades later, and you took up the mantle. for them.
Yes, I did. I'm very proud of that. And I love doing this and taking care of women and letting them understand their bodies and explaining births. And it's a very happy and rewarding time for me.
It is, and giving birth should be a happy and rewarding experience. It shouldn't be a dread that comes along with that. You should, really relish that period of time in your life.
Right.
You really should.
Exactly. And so by explaining things to them, sitting down, step by step, I tell people we talk in a language sometimes in the hospital, this medical jargon. And so I just explain to them, if at any time that I'm saying something that you don't understand, please stop me so that we can explain it to you and in a language that you understand, because we want this experience to be a happy experience for them. And that's how come we do these birth plans and all, so that we can have this joyous experience here.
Have you seen a lot of success with that?
Absolutely, absolutely. There is a time where we're crying, we're happy, and celebrating, and that's what we want to do, the celebration of life.
And after birth, there are a lot of, you're dealing with motherhood, you're dealing with a lot of hormonal things that are going, you're dealing with this new body. Will I ever be the same again? But you can be better, actually, than before. So it's good to know that you have someone who understands what a woman is going through during this period in life.
Right, right. Giving them that support and encouragement and telling them, you can do it, giving them, that personal feedback. It's like, it is difficult sometimes, but I've done it once, I've done it twice, and you know what? I would do it again. The joy of motherhood.
Very good, very good. Well, we've been talking about midwifery today, and I'm so glad I got that right. I thought it was midwifery. Yes. But I'm so glad you could join us this morning. We've been talking to Billie Hamilton Powell. She's a certified nurse midwife and the director of midwifery services for the University of Maryland Capital Region Health. Thank you so much. Happy births to all those women out there.
Thank you.
Who you're helping to take that next step into motherhood.
It's been a pleasure.
You've been watching the Sisters for Fitness Wellness Show. I'm Stephanie Gaines-Bryant. Have a great day.